I think for me personally, everything that I do in any aspect of my work, I'm trying to think about how we can build groups, how they can work together, how they can trust each other. Hi, my name's Dr. Kate Goldie. I'm an aesthetic physician and I'm based here in the UK. For me, what happened was I had absolutely no intention of staying in aesthetics, none at all. I was literally just having a little curious look at botulinum toxin, and what I found was that it profoundly changed the way I thought about healthcare. Because when I did those very simple treatments 18 years ago, using botulinum toxin to take away some wrinkles in between the forehead, like, the change was profound. Not just the physical change, like I was so impressed that it really worked, but more that the patients, my very first patient, and I can remember her to her this day, the way that she walked back into that room after I did the treatment 2 weeks before, it convinced me this was something that was worth pursuing. Her confidence, and it's well before we talked about confidence or any psychological benefit of aesthetics. This is what it transformed her. So my particular journey would be, I would go and look into other spheres of medicine, and this culminated in examining regeneration and the whole world of regenerative medicine, bringing that into our sphere as much as I possibly could about 9 years ago. My colleagues have been absolutely key to helping me develop that, have confidence to do that, and in particular my female colleagues have helped me in a collaborative way be able to think that through. So it's been a long journey, but it has been the most unique one I could possibly have taken within medicine. And I think that my female colleagues, they have been amazing in working collaboratively, encouraging collaborative work and thinking together. So with a little bit of less, these are generalizations I understand, but with a bit of less worry that you might be seeing something or not understanding something, so the ability to be able to be vulnerable and collaborative, like for me, that is the key to success. It's key to success in really specific ways. The number one, of course, is when everyone gets together, then when you talk to each other, that you become more than the sum of the parts. So you become, whatever comes out of that is much more powerful than that would come out of any one single individual. That is what will make us drive the whole field forward. And it what allows us to properly think through the path, innovation, the future, because we share our thoughts and we try and go there together. And that has been huge. I think that is a kind of a female way of working, and it has it's by far the biggest solution. It's by far the winner. One of the key advantages, or something that women really bring as leaders in aesthetic medicine, is that many women work collaboratively. And there's a great phrase, a famous quote, where you say that if you want to go fast, you go alone, but if you want to go far, then you go together.